There are several nurse influencers who have gained significant followings on social media platforms like TikTok, Instagram, and YouTube. These influencers come from various nursing specialties and have made names for themselves by sharing educational content, funny skits, daily routines, or personal experiences in the nursing field. However, their presence also raises questions about professionalism, privacy, and the impact of social media on patient care and the public's perception of nursing. Several of these nurse influencers have been involved in controversies or drama recently. Stay tuned. Number 1. Mickey has over 2 million followers on TikTok and is active on YouTube and Instagram. Mickey is a registered nurse who creates content focused on healthcare education, nursing tips, and her personal experiences in the profession. She often discusses nursing school, NCLEX preparation, day-in-the-life videos, and health issues like COVID-19. Mickey is known for her approachable style and informative content. She has faced multiple controversies over the past couple of years. Recently, she was accused of posting misleading content on TikTok about her experiences as a nurse during the COVID-19 pandemic. Some viewers felt that her content dramatized or sensationalized certain situations for views. There were also accusations that some of her videos were staged or exaggerated, which led to criticism from both the nursing community and the public. In one instance, she posted videos that were reenactments of events she said happened while she was on duty, but the reenactments were presented in a way that some viewers thought implied they were real-time recordings. Some users accused her of faking her involvement in critical care situations or using dramatic scenarios to gain followers. The nursing community on TikTok and Instagram quickly became divided, with some nurses defending her right to use her platform for education, while others felt she was undermining the profession by allegedly prioritizing content creation over patient care. Mickey has defended her content, stating that her intention is to educate and bring awareness to healthcare topics. She has also clarified that some of her videos were reenactments of real situations to protect patient privacy. Number 2. Katie is an experienced nurse and motivational speaker who shares her insights on nursing, self-care, and professional development. She is known for being candid about the challenges she has faced in her career, including getting fired for a social media post and advocating for nurses to know their worth and set boundaries. She has over 100,000 followers on Instagram. Katie has a long history of being outspoken on social media, and she's been involved in controversies surrounding her content. She has been at the center of nursing drama since 2014 when she was fired from her job at New York Presbyterian Hospital for posting a photo on Instagram that showed an empty trauma room after a patient resuscitation. The caption read, "Man vs. 6 train." The after, which led her employer to fire her, claiming the post was insensitive and violated privacy, even though no patients were visible. The firing sparked a conversation about free speech and the limits of personal expression for healthcare professionals. Recently, she has continued to speak out about the challenges faced by nurses and the pressures from employers, occasionally facing backlash from those who disagree with her strong opinions. Katie has remained unapologetic and vocal about her stance on nurses' rights, self-care, and the need for systemic change in healthcare. She continues to use her platform to advocate for nurses, address controversial issues head-on, and encourage open discussion. Number 3. Blake Lynch, as known as Nurse Blake. Known for his humorous skits and relatable content about the challenges of nursing, Nurse Blake often pokes fun at everyday situations nurses face, such as difficult patients, awkward interactions, and the chaos of working shifts. He also uses his platform to advocate for nurse rights, mental health awareness, and work-life balance. Blake has launched his own comedy tour called the PTO Tour, where he performs stand-up comedy specifically geared toward healthcare workers. Blake has over 2 million followers across platforms. While Nurse Blake is primarily known for his humorous content, he has recently come under fire from some in the nursing community who feel his comedic approach might sometimes downplay the seriousness of nursing challenges. For example, Some critics argue that his comedy routines during his live shows, like the PTO Comedy Tour, could trivialize or oversimplify complex issues such as nurse burnout, mental health, or patient safety. Blake defends his style as a way to bring humor and lightness to a profession that is often filled with stress and burnout. He argues that laughter is a form of self-care and that his intention is to unite and uplift the nursing community, not to diminish the challenges nurses face. Number 4. Nurse Nicole. Nicole is a family nurse practitioner who shares educational videos on clinical nursing topics, patient care tips, and advice for new nurses. Her content is often more focused on the academic side, including videos on pharmacology, nursing assessments, and clinical skills. She has over 300,000 followers on YouTube. Nurse Nicole has faced criticism from some followers who believe that her content has become too commercialized, as she frequently partners with brands to promote products or services. Some in the nursing community feel that this detracts from her original purpose of providing free educational content. The criticism intensified after she promoted several non-medical products, leading some to question the authenticity of her endorsements. Nicole has addressed this feedback by stating that partnerships help support her ability to continue producing free educational content for her followers. She emphasizes that she only partners with brands that she genuinely supports and that are aligned with her values. Number 5. Drive. Kat Calamani. A registered nurse and mom, Dr. Kat shares content on health education, lifestyle, and family. She often addresses common health myths, provides wellness tips, and shares her experiences in both her personal life and professional practice. She has over 500,000 followers on TikTok. Dr. Kat recently found herself in hot water over TikTok videos that were seen as potentially promoting pseudoscience or health misinformation. In particular, she made a video about health and wellness topics that some viewers and fellow healthcare professionals found questionable or lacking scientific backing or relied on anecdotal evidence. For instance, she has discussed wellness tips and home remedies that some experts argue are not well supported by evidence. This led to some pushback from the medical and nursing community. Kat addressed the criticism by explaining that her content is meant to provide general advice and should not be seen as a substitute for professional medical consultation. She emphasizes that her goal is to raise awareness and encourage people to seek proper medical advice. These dramas highlight the ongoing tension between professional conduct and personal expression on social media for healthcare workers. Nurses must navigate the complex dynamics of being visible online while maintaining patient confidentiality, employer policies, and professional standards. The controversies also impact how the public views nurses and healthcare workers. Positive and educational content can help build respect and appreciation for the profession, while content deemed inappropriate or controversial may feed into stereotypes or misconceptions. As these dramas unfold, there's a growing call within the nursing community for clearer social media guidelines from healthcare organizations and professional bodies. Many nurses feel that existing rules are outdated and don't account for the rapidly evolving digital landscape. Wow! What a whirlwind of drama in the nursing community. As we've seen today, being a nurse influencer is about so much more than just posting content. It's about balancing education, entertainment, and professionalism, all while navigating a world where every post can spark a debate. Whether you're Team Mickey, Team Blake, or just here for the tea, one thing's for sure. These influencers are stirring up some important conversations about the future of healthcare, social media, and the role of nurses in the public eye. So, what do you think? Are these influencers crossing the line, or are they just shaking up the status quo in all the right ways? Drop your thoughts in the comments below. Let's keep the conversation going. If you enjoyed this deep dive, make sure to hit that like button, subscribe, and ring the bell so you never miss out on the latest nursing news and drama. Thanks for watching, and until next time, stay curious, stay compassionate, and, of course, stay drama-free.